Okay, now the management of hepatitis B virus. Okay, the management of hepatitis B virus is categorized into three categories: the prevention, how to prevent the hepatitis B virus, the first thing; second thing, the prophylaxis of hepatitis B virus; third thing is when to treat, what is treatment of hepatitis B virus. Let's start with the prevention, which is the very important, the most important thing is to learn how to prevent hepatitis B virus. You have to avoid the things that may lead to the infection, and you have to screen for the virus. Okay, so you have to change behavior. For example, in drug addictors, they have to stop taking needles from each other. Okay, they have to stop taking needles at all. Okay, but for the hepatitis B, sharing needles may lead to the infection, so this is thing that they can change. Okay, in screening for hepatitis B virus, for example, mother, siblings, and the child screening if we suspect it have some jaundice. Okay, test blood products. So when somebody want to donate some blood to other body, we have to test this blood. How? By detecting the presence of hepatitis B surface antigen. Okay, and the hepatitis B surface antigen is not enough. Why? Because we have a window period. I told you about the window period. When we have no surface antigen and no anti-hepatitis surface antibodies, the only thing we have is the anti-hepatitis B what? Core antibodies. So it is a must to detect the presence of anti-hepatitis B core antibody to know if we have hepatitis B infection or no. Okay, other thing we can do to prevent hepatitis B is the vaccination. Okay, vaccination is very important in health worker, for example. Okay, what to give? What is the vaccination of hepatitis B virus? It is the hepatitis B surface antigen. They give killed surface antigen, and that will form antibodies, which is the hepatitis B surface antibody. In the previous video I told you that the presence of hepatitis B surface antibody tells you that you have an immunity to the infection, either due to vaccination or due to natural infection that preceded. How to give the vaccination? We give 3 doses, that is 0.1 months later and 6 months later, so 3 doses. This is all about the prevention of hepatitis B virus. What about the prophylaxis of hepatitis B virus? When to give prophylactic drugs and what to give? What we give is hepatitis B immunoglobulin, and we give it in 3 cases: when we have perinatal exposure of the hepatitis B, when we have contaminated blood transfusion or liver transplant, that liver that is affected by hepatitis B. Okay, and the third case, and when we have contaminated needle stick. Now let's start with the perinatal exposure. If we have a mother with hepatitis B virus, once she give birth to her child, we have to give him 2 things. The first one is the hepatitis B immunoglobulin, and the second one is the vaccination. So both of them should be given, the hepatitis B immunoglobulin and the vaccination. This should be done in the first 24 hours. So please remember, in the first 24 hours, okay, we give immunoglobulin and we give the vaccination, okay, which is hepatitis B surface antigen. This is the first case. Okay, the second case, or B, this is A here. B, if we have a contaminated blood transfusion, we transfuse blood and we find out that it is contaminated with hepatitis B. Okay, if we have a liver transplantation or transfusion of liver from a contaminated or infected person to other one, we have to give hepatitis B immunoglobulin pre and post to transfusion, okay, plus the vaccination, of course. If we have contaminated or infected needle stick, okay, you have to give the prophylaxis, which is hepatitis B. I'm sorry, hemoglobin. Hepatitis B immunoglobulin. Okay. Now the treatment of hepatitis B. Okay. We have acute infection and the chronic infection, and the chronic infection is divided into three cases: the carrier state, the active state, the inactive state. I told you in the previous video that depends on the normal liver enzymes, on the DNA, and the hepatitis B envelope antigen. Sorry. Okay. The acute infection treatment is supportive treatment only. The chronic infection, we only treat the active chronic infection. We don't treat the carrier state. We don't treat the inactive or the immune tolerance. Okay. So we only treat the active state. The active disease, when we have a DNA positive, when we have envelope antigen positive, when we have surface antigen positive. Okay. So this is when we treat. Okay. So again, in other words, the indication for treatment is only when we have active patient or active disease, chronic active disease, and that when we have envelope antigen positive, when we have positive DNA, and when we have elevated liver enzymes, again more than double liver enzymes. Okay. And the chronic infection should be chronic more than 6 months. Okay, if we have these values more than 6 months, so we have a chronic state, and we have active state because we have positive status, because we have positive DNA and positive or elevated liver enzymes. Okay, so before treatment you have to see, is it a chronic infection? Yes, it is more than 6 months infection, so it is a chronic. Is it active infection? Yes, we have DNA positive, we have envelope positive, we have elevated liver enzymes, so you can treat now. The goal of treatment actually is the remission of the DNA positive value into negative DNA value, the positive envelope value into negative envelope value, the positive surface antigen into negative antigen. Okay, so it is a conversion into carrier state. From the active, you want to convert the patient from active into carrier state. So the elevated liver enzymes will decrease, and the DNA will be negative, surface antigen, envelope antigen will be negative. Okay, so this is the goal of treatment, and also to resolve the biological and histological status of the patient. How to treat, what medication you give antivirals. Interferon alpha used to be used, okay, but now they mostly use the oral medications like Adifovir. Okay, Adifovir. So this is the treatment or management of hepatitis B, the prevention, the prophylaxis, and the treatment only in chronic cases to make the active case just a carrier case. Okay, طبعا surface antigen that is positive in the active case, it will not always be negative in the carrier state. Actually, the patient that will have it negative after treatment will be a lucky patient. Okay, but we still count it as remission if we have positive surface antigen. If we have envelope antigen positive that is negative. Okay, so oops, I'm sorry. Okay, I'm sorry, that is positive. Okay, so this is the remission. The remission does not depend on surface antigen. This is the conclusion. Thank you very much for watching these videos on hepatitis B virus. I talked about the definition, the epidemiology, mode of transmission, the diagnosis, and the management of hepatitis B virus. See you in the next video talking about hepatitis C. Thank you very much.